And a good Saturday morning to you. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic in Rockford, Illinois. And we were talking recently about supplements. I guess this would be a related topic, nutrition, Dr. Jim.
Absolutely. Fred, today, we've got a lot of listeners that have questions regarding different health topics, and it seems that I get more questions sent me regarding nutrition than even chiropractic questions. And so I'd like to deal with some of these things here and just talk a little bit about nutrition or nutritional therapy, we could say. There are really 5 things that we might say are essential to looking at nutrition. And the first thing is diet and lifestyle. A lot of times people think, well, I know I got a crummy diet, but I take this vitamin pill, or I take these supplements, and just the very word supplement means it's supposed to supplement something and not be in place of. And so diet and lifestyle are very important, and we just can't think that we can take some type of tablet and that means that we can live a crummy lifestyle. And when you take a look at families, and a lot of people say, well, obesity runs in my family, or we're all heavy in my family, or whatever the thing might be. It's not always genetics. Now, true, genetics plays a factor in that you might be a large-boned individual, and that runs in your family, and so just your bone structure is such that you're going to be a greater weight. It'll usually affect your metabolism, so your metabolism might be a little bit slower. And so it's easy to pack on the pounds when you're that type of body structure. But everybody knows the real thin person that can eat all he or she wants, and, they never get fat. I don't understand that,
And there are people that seem to be like that.
Yeah, they are like that. So you've got that factor, that there is a genetic factor, but most often it's a lifestyle. And so you might say, well, everybody in my family is overweight. One reason is everybody is eating a similar way. Maybe if you're eating pasta every meal, and, that's just part of our family's diet. We always eat that, and then, we look like a bowl of pasta,
Right.
Or maybe we eat a lot of bread in our family, and so, there's a lot of carbohydrates that are being turned into fat. And so eating is very important, and we pass on to our children and children's children the way we eat.
And, of course, even people who tend to be thin and don't put on weight can have an unhealthy lifestyle and end up with heart problems if they have an improper type of diet.
Excellent.
Or lack of exercise.
Absolutely. Lack of exercise. That a lot of times goes with lifestyles also. If you have a family that likes to do things together, they like to go biking together, they go to the park frequently and such, that's going to be a healthier lifestyle than someone that we always watch TV together.
Right.
And so, diet and lifestyle are very important when looking at nutritional treatment and therapy. Digestion. We mentioned previously a week ago that digestion is very important. If you're not digesting the food properly, then a lot of that food, even if it's good food, is going through you, even if it's the most expensive vitamins and nutrients that you're taking. If your body is not breaking it down properly, it's going right through your system and doing you little to no good at all.
And you're not assimilating the nutrients.
You're not assimilating them. And your body needs to break down the food and the supplements that you take properly so that they can be absorbed properly so your body can use them. So a lot of times people think, well, I eat a good diet, but if your digestion is messed up, if you've got stomach complaints, if you've got constipation, if you've got acid indigestion, if you've got a hiatal hernia or acid reflux, all these things, and you're taking different drug therapies for that, you are definitely having nutritional problems, even if you're eating well, because your body's not digesting it properly.
So if a person does have those digestive problems, what do you do in terms of nutrition to set it right?
Well, first, nutrition, that's very important. One of the things that we would do is make sure that that person is getting proper stomach acid. Now, your body, your body has normal secretions, and they're either alkaline or they're acid. And now, when you chew on something, your saliva should be somewhat alkaline and mixes with your food so that your body can break down carbohydrates well. That's the first step in digestion, is mixing your saliva with your food. When you swallow it and it goes into your stomach, that's where it becomes very acid. And it needs to be acid so that it can break down, especially the proteins that you eat.
But what if that acid is causing a person problem with acid indigestion and they don't want it, so they take Tums or whatever?
That's kind of what they tell you, Fred. When you've got $64 million a day the drug companies advertise with, and they try to tell people, well, you've got excess stomach acid, so therefore you need to neutralize that, and you need to take Pepcid, you need to take Zantac, Tums, Alka-Seltzer, Pepto-Bismol, Mylanta, all these different things that you take to negate the stomach's acid. And the real problem, Fred, it's not too much acid. The problem is not enough acid. Not enough acid. And I know, because I tell this to patients, and I give them acid tablets to take. Take a couple acid tablets when you eat, and you'll be amazed. Your stomach, it feels great. It starts digesting the food. You don't have acid indigestion anymore because you're getting enough acid so that your body breaks it down. The problem is not enough acid, Fred. It's not too much. And when your body's not making enough acid, it doesn't go through your stomach properly. In other words, the acid would help the digestion, so it goes into the small intestine. And when it doesn't go in there because your body's not making enough, that's when the food starts spoiling in you. Basically, it's just decomposing in your body, and you're hanging on to it for 2, 3, 4, 5 hours, and your stomach aches. So there's acid in there, and so you take the antacid to try to negate that. But when anybody that takes an antacid, let me say this so everybody can hear, anybody and everybody that takes antacids is not fixing the problem. All they're doing is trying a relief solution here. But everybody that takes these products have nutritional shortages somewhere, calcium being a big one, because your body can't break down calcium. Your body needs to have calcium in an acid environment. And so if it's an alkaline environment, it goes right through you. So here's the scenario, Fred. People come in and they've got acid problems. The doctor says, well, you need an antacid. You've got too much acid in your stomach. So they take the antacid, and they're getting some relief, but they have to take it all the time. You can't skip taking it. And then they're not getting enough calcium then that's absorbed in their body. So lo and behold, after a little while, they go, oh, my, you've got osteoporosis, and you don't have enough calcium. So you need to take Boniva. We need to get you on this other drug now that's going to screw up your bones also long term. So the one supposed solution causes the problem that they treat another one for. And people that are on certain drugs like Pepcid and AC, Zantac and such, they have 4 times the fracture rate, Fred, of people that don't take it. 4 times.
And you were telling me you went to the drugstore and started counting the antacids and came up with over 100.
I counted 149, Fred, before I came in today. 149. There was extra strength Pepcid. There was long-lasting Zantac. There was Tums. There was cherry Tums. You could have Alka-Seltzer, and they had other times, and Pepto-Bismol, and then the store brands, and Mylanta, and long-lasting and effective. This is the stuff that people are being told every day, that, and you take it, and yeah, it does help the acid indigestion, but it's going to give you fractures. You're going to have broken bones, hip replacements when you get older, and it's because your body doesn't have enough acid.
So now when you say acid tablets, are you speaking of acidophilus or? No,
acidophilus is an acid-loving, that's what acidophilus means. It's an acid-loving bacteria. It thrives in an acid environment. So, yeah, you need that type of bacteria, too. That's another issue. If you don't have proper acid in your stomach, those bacteria aren't going to be proper either.
So what are the acid tablets that help your digestion?
Okay, it's a product called Zypan is what I use. There are other ones, but it's an acid tablet. It's stomach acid in a tablet form. You take that, and you take that like in the middle of the meal, and then this acid is released, and it will help digest the food. And everybody, as you get older, Fred, we'll talk about this next week, but as you get older, your body doesn't make as much acid as it used to. And so one of the reasons why senior citizens have nutritional problems is because their body doesn't make enough acid. Their diet might be good, but their body isn't using
and this supplement actually will help the digestion and take away the heartburn problem.
It will make it so you don't get the heartburn.
All right.
It won't make it go away. You won't get it.
All right.
And so that's the wonderful thing. So very important, digestion, and it starts in your mouth when you mix the saliva. But then and that's why we should eat properly, slowly, chew all the food. Do what your mother told you to do, Fred. Chew your food. Don't swallow it whole.
Right.
Your mother was right. Start the digestion properly, and then as it goes into your stomach, take the digestive aid, which would be stomach acid and not the alkaline. It's exactly opposite from what we're being told, Fred.
All right. Well, I know you have more information at your office and online.
And people can contact us, Fred, at www.warnerchiro.com. That's WARNERCHIRO, warnerchiro.com, or they can call us at 815-398-8111.
And we'll talk more about nutrition next week as well.
Absolutely.
All right. That's going to wrap it up for Health Matters today.